Good morning. Welcome to Spring Valley, California. Beautiful day, sunrise on my face. This is from forpay.org, Consumers Doctor, Dr. Bengala. The role of the government in healthcare. That is the topic for today. A lot of youngsters are not sure what the role of the government should be. But I believe as a human being, as an individual, we have a lot of power. As a consumer, you have a lot of power. I want to keep that individual freedom in healthcare. I don't want the government to take away my money. Right now, I believe the Medicare is misusing my funds. My healthcare funds are being misused and they're being spent on the insurers. I don't like it. I really don't. I wish Department of Health and Human Services and Washington representatives and Senate, they're listening, because Medicare is being misused and that's why the funds are dwindling and they are spending the money on the wrong places, especially the insurance companies, managed care companies. There's a 20% overhead, 25% overhead. If I receive that $1,400 every month, I can buy the best health insurance I can. And I can put money aside into my health savings. I don't know why is it that once you become a Medicare, you cannot contribute to your health savings. I wish they changed the law. I should be able to contribute because on Medicare, I cannot contribute. That's not supposed to be like that. But if they invest in me the $1,400 like they're investing in the insurance companies, I would take that money. I will get the best deductible health insurance, man. I will save tons of money, put $700 of my money into my own health savings for my future healthcare needs. I don't have to depend on the handouts or the government. Yes. I believe the role of the government is limited, folks. Government, when it becomes too big, too bureaucratic, there are too many problems. They all talk about this, government's role in healthcare in Canada and Britain. You haven't heard the stories on the other side of the coin. People, they have a two-tier system, folks, in England and in Canada. They have healthcare for the rich, healthcare for the poor. You want that kind of a system? Healthcare for the rich and healthcare for the poor. People have the money. They come to US and pay cash. People in England, they have a two-tier system. And these representatives, they keep harping on beautiful socialized medicine England has. They don't understand what we have. We are a country based on individual freedom, individual rights, free markets. Look at what we have come this far. We cannot go back on healthcare, man. There is no way. Technology is on your side, folks. I believe technology will change. Already, COVID-19 has done one good thing. Technology has gone to the forefront of telemedicine. And it's coming. These software companies, these billing companies need to go. There's no role for the billing companies. Software is nice. I have no problem, but we can create a software, but not to use for the billing. This billing system has to go. Pay as you go. This health savings accounts concept with a deductible health insurance policy is the way to go. I understand people who can't afford it, everybody say, oh, we can't do it. For the people who can't afford it, who have no job, no. Yes, but there is a way to do it, folks. If you're really looking at people who can't afford the health insurance and it's too costly, first of all, hospital billing is it's a sham. I'm telling you, hospital billing is a sham. It's like ATM machine. It can't go on like that. It can't. What I'm talking about, the healthcare billing, healthcare for the impaired and low income, it can be easily be implemented by the Health Review Authority under the public-private partnership, folks. Health Review Authority goal is to take care of those 2 to 3% of the population who can't afford health care. They will give you a certificate of guaranteed coverage. It's where you can go and get your best private health insurance. And there are ways to do it, folks. There are innovative ideas. I love the Dr. Ronald Bachman, actuarial from Texas, and his book is amazing. I like his way of thinking. I listen to his podcast. You guys, if you get a chance, you should listen to his podcast, Healthcare Visions. He has Healthcare Visions, Healthcare Insight podcast. Let's limit the role of the government, folks. I really believe we need individual freedom. People can take care of themselves. I believe in individuals. Take care of your own health. If the way things are, one of the reasons we have obesity, I'm telling you, not only the mental health is a challenge to fight for the mental health. When they have depression, they consume the wrong food, wrong, couch potato, things of that nature. We need to discourage that, folks. I really mean it. If there's a value, guys, this is from the foremost organization, Consumers Doctor. You need to subscribe, share, contribute. I would love to see people contribute. Our goal is to have access to healthcare for all, irrespective of their economic status. Irrespective. And we need you to be in charge, a consumer, Americans to be in charge. There are lots of ways, folks, we can deliver healthcare to individuals through so-called debit cards, health savings cards, whatever you may call it. Subscribe, share, make some comments. We will see you in the next episode. Thank you, guys. I love you. God bless. Goodbye.